SABC Sport brings you Chasing the Sun, a powerful 5-part documentary series about the Springboks, telling the rousing tale of their path to redemption and ultimate World Cup glory in 2019. Tune in every Sunday between 7:30 p.m. on SABC2 for the highs, the heartache, and the heroics that made rugby history. Stream each chapter on SABC Plus anytime, anywhere. No subscription needed. Don't miss Chasing the Sun this Sunday at 7:30 p.m. on SABC2. Be there when history shines.
Heartlines, 10 p.m. to midnight Central African Time with Sheila Ndikumana. Heartlines, 10 p.m. to midnight Central African Time with Sheila Ndikumana.
12 minutes after 10 p.m. Central African Time, just to give you a scope of the day, or rather the evening that lies ahead of us. We kickstart off with the station recap. This is an opportunity to look at some of those leading conversations that we hosted from 6 a.m. all the way through to 10 p.m. And so we'll do that roundup with you. And then we follow through with a conversation with our guest this evening. So what if waiting years for surgery became a thing of the past? Is my question to you. Up next, we are joined by Dr. Viola Morolo, a leading urologist and the founder of African Synergy Health, here to unpack Mandela Week Surgical Marathon, her fight to eliminating backlogs in public hospitals, and how lives are being transformed through action and not just awareness. I'll also be finding out from you this evening on the purpose behind pursuit. And we're specifically looking at our world of work. This is your career path, your passion project, all of these all encompassing. We'll have a discussion about that right after that conversation with Dr. Viola Morolo. And that's what sums up Heartlines for this evening. Do reach out to us, finding us on WhatsApp, +27 6340 69126. For now, it's back into the music.
Heartlines, your late night window into Africa's deep conversations.
Million boy, 13 milli with another.
For brands, media planning, and advertisers, Channel Africa is more than just a platform. It's an opportunity. With 25 compelling shows covering current affairs, sports, business, music, and lifestyle, we deliver an engaging Pan-African audience ready to connect, invest, and act. Multi-award winning, internationally recognized, digitally accessible across the globe. When Africa speaks, the world listens, and Channel Africa makes sure of it. For business, for culture, for Africa, partner with Channel Africa, because Africa's voice is the future. Africa is a story. A living, breathing, ever-evolving masterpiece. And for over 5 decades now, one voice has told it like no other. Channel Africa. More than just a broadcaster, Channel Africa is the pulse of the continent. African-led, African-run, and deeply rooted in its heritage. It's the only international station that speaks to Africa in its own voices. English, Kiswahili, Chinyanja, French, and Portuguese. The languages that unite 1 billion people. We have been there through every shift, every milestone, and every triumph. Not just reporting history, but shaping the conversations that define Africa's future. For brands, media planning, and advertisers, Channel Africa is more than just a platform. It's an opportunity. With 25 compelling shows covering current affairs, sports, business, music, and lifestyle, we deliver an engaging Pan-African audience ready to connect, invest, and act. Multi-award winning, internationally recognized, digitally accessible across the globe. When Africa speaks, the world listens, and Channel Africa makes sure of it. For business, for culture, for Africa. Partner with Channel Africa because Africa's voice is the future. Africa is a story, a living, breathing, ever-evolving masterpiece. And for over 5 decades now, one voice has told it like no other. Channel Africa. More than just a broadcaster, Channel Africa is the pulse of the continent, African-led, African-run, and deeply rooted in its heritage. It's the only international station that speaks to Africa in its own voices: English, Kiswahili, Chinyanja, French, and Portuguese. The languages that unite 1 billion people. We have been there through every shift, every milestone, and every triumph. Not just reporting history, but shaping the conversations that define Africa's future. For brands, media planning, and advertisers, Channel Africa is more than just a platform. It's an opportunity. With 25 compelling shows covering current affairs, sports, business, music, and lifestyle, we deliver an engaging Pan-African audience ready to connect, invest, and act. Multi-award winning, internationally recognized, digitally accessible across the globe. When Africa speaks, the world listens, and Channel Africa makes sure of it. For business, for culture, for Africa. Partner with Channel Africa because Africa's voice is the future. Africa is a story, a living, breathing, ever-evolving masterpiece. And for over 5 decades now, one voice has told it like no other. Channel Africa. More than just a broadcaster, Channel Africa is the pulse of the continent, African-led, African-run, and deeply rooted in its heritage. It's the only international station that speaks to Africa in its own voices: English, Kiswahili, Chinyanja, French, and Portuguese. The languages that unite 1 billion people. We have been there through every shift, every milestone, and every triumph. Not just reporting history, but shaping the conversations that define Africa's future. For brands, media planning, and advertisers, Channel Africa is more than just a platform. It's an opportunity. With 25 compelling shows covering current affairs, sports, business, music, and lifestyle, we deliver an engaging Pan-African audience ready to connect, invest, and act. Multi-award winning, internationally recognized, digitally accessible across the globe. When Africa speaks, the world listens, and Channel Africa makes sure of it. For business, for culture, for Africa. Partner with Channel Africa because Africa's voice is the future. Africa is a story, a living, breathing, ever-evolving masterpiece. And for over 5 decades now, one voice has told it like no other. Channel Africa. More than just a broadcaster, Channel Africa is the pulse of the continent, African-led, African-run, and deeply rooted in its heritage. It's the only international station that speaks to Africa in its own voices: English, Kiswahili, Chinyanja, French, and Portuguese. The languages that unite 1 billion people. We have been there through every shift, every milestone, and every triumph. Not just reporting history, but shaping the conversations that define Africa's future. For brands, media planning, and advertisers, Channel Africa is more than just a platform. It's an opportunity. With 25 compelling shows covering current affairs, sports, business, music, and lifestyle, we deliver an engaging Pan-African audience ready to connect, invest, and act. Multi-award winning, internationally recognized, digitally accessible across the globe. When Africa speaks, the world listens, and Channel Africa makes sure of it.
Minutes after 10 p.m. Central African Time. Burna Boy coming in with that golden oldie titled Soke. Before that, a trip all the way to Togo with Paki Chenzu, and that one titled Millions Boy. If you've just joined us, welcome to it. This is Heartlines, and in this moment we're going to take an opportunity to recap some of the top stories covered across the station. Let's start with Rise and Shine with Peter Ndoro and Asanda Beta. The team dove into the headline-grabbing news that 92-year-old President Paul Biya is officially running for re-election. If victorious, this would mark his fourth term in office, potentially keeping him in power until he's 100 or nearly 100 years old. As the world's oldest serving head of state, his health remains a topic of question and concern, and of course speculation. The re-election bid, long anticipated, was finally confirmed by a bold social media announcement.
Let me ask you this. Last appearance, 20th of May. That's almost 2-3 months ago. Why would he announce something so important as his candidature for presidency on social media instead of appearing in public and showing people that he's fit for purpose?
Oh, no, there are many methods of political communication or communication in general. I think President Biya is not the only one who enjoys the method or uses the method of high tech or the digital method.
And we're now joined by Professor Elvis Ngole, who's a senior member of the ruling Cameroon People's Democratic Movement, the CPDM party, and serves as the coordinator of its political academy. Biya, he's 92. Really, can he still run the country at that age?
The minimum age for running for the office of president is 35. And the Constitution does not specify a maximum age.
The law allows him to. What I'm asking is, does he still have the ability to?
That is, I think it's only a doctor, a medical doctor or so, who can make that determination.
Moving on to On the Move with Palisa Tau and Benjamin Mshatama, a powerful spotlight was placed on the Maputo Protocol, Africa's landmark women's rights treaty, now celebrating its 22nd anniversary. This treaty continues to play a pivotal role in advancing gender equality and empowering African women through legal reform, and policy change.
Protocol is, first of all, and I'm sure even though this is in the advancement of women's rights, many women across the continent are only hearing about the Maputo Protocol for the first time.
So the Maputo Protocol, as you mentioned, is a protocol to the African Charter on the rights on human and people's rights, on the rights of women, and it was adopted in 2003, and it is a unique document because it is by Africans for Africans, seeking to protect and promote the rights of women and girls in the African continent. And what's really unique about the document, unlike other UN, for example, UN documents like the Convention on the Elimination of All Forms of Violence Against Women, is that it does speak to the unique cultural and religious experiences of women in the continent. For example, the Maputo Protocol seeks to protect women from harmful cultural practices. For example, like the practice of female genital mutilation, which is recognized as a harmful practice, the practice of forced and early child marriages. And interestingly, the Maputo Protocol also requires or allows for women to enjoy what is called a positive cultural context.
We're speaking to the Program Officer of Legal Equality at Equality Now, Gishuku Karugu.
And then we move on to the Africa update with Lulu Gabu in recognition of World Youth Skills Day. Lulu Gabu raised the critical and personal question: What skills have you acquired? And what are you passing on to today's youth? The segment challenged listeners to reflect on their role in empowering the next generation through mentorship and education. Now, on the upside, with Tebogo Lekhuleni and Matsheko Mosito, an exploration of the latest aesthetic advancements, diving into non-invasive treatments and non-surgical procedures for eliminating a double chin. The segment broke down modern, accessible options for those looking to enhance their confidence without undergoing the knife.
While beauty standards evolve, one thing many people continue to grapple with is the double chin. Whether it's due to age, genetics, or stubborn fat, this area has long been difficult to treat until now. And today on The Upside, we are joined by esthetician Quinette Oransay to unpack the most effective treatments for targeting the chin and neck area, no surgery required. But are the results permanent? Yes. Are they permanent, or do we require to maintain them on a regular basis?
Most of the time they are permanent, but you have to live a healthy lifestyle, good diet, exercise, to maintain the results.
I'm taking some tips from that one. Lastly, Africa in Business with Tami Ngubeni. Tami spoke to Mvelo Ndlovu, lead strategist at Brandscapers Africa, about the upcoming Next Gen Impact Summit. This taking place in Mpumalanga. The summit is set to empower a new wave of entrepreneurs and creators, particularly from rural communities, by creating pathways to innovation, opportunity, and long-term growth. This is how we wrap up today's station lineup, a full spectrum of bold voices, impactful conversations, and fresh perspectives. Stay tuned, stay inspired.
Heartlines with Sheila Kumana brings you conversations that touch the soul on Channel Africa. For business, for culture, for Africa. Partner with Channel Africa, because Africa's voice is the future. Africa is a story, a living, breathing, ever-evolving masterpiece. And for over 5 decades now, one voice has told it like no other. Channel Africa. More than just a broadcaster, Channel Africa is the pulse of the continent, African-led, African-run, and deeply rooted in its heritage. It's the only international station that speaks to Africa in its own voices: English, Kiswahili, Chinyanja, French, and Portuguese. The languages that unite 1 billion people. We have been there through every shift, every milestone, and every triumph. Not just reporting history, but shaping the conversations that define Africa's future. For brands, media planning, and advertisers, Channel Africa is more than just a platform. It's an opportunity. With 25 compelling shows covering current affairs, sports, business, music, and lifestyle, we deliver an engaging Pan-African audience ready to connect, invest, and act. Multi-award winning, internationally recognized, digitally accessible across the globe. When Africa speaks, the world listens, and Channel Africa makes sure of it. For business, for culture, for Africa. Partner with Channel Africa, because Africa's voice is the future. Africa is a story, a living, breathing, ever-evolving masterpiece. And for over 5 decades now, One voice has told it like no other.
They're coming through Makadzi with this one titled Number One alongside Ianya and Prince Benza representing South Africa on the playlist this evening. If you've just joined us, a blessed and beautiful one to you and yours. Welcome to Heartlines. Shayla and Dikumana with you for the next hour and a half. Time for us to get into conversations that will inspire pursuit in purpose. And by purpose, we speak of these, I suppose, career paths that we spend so much time and space trying to acquire. And I suppose one such event and one such experience is that with our urologist who will be joining us in not too long from now. I'd love you to prepare yourself to send through your questions, finding us on WhatsApp +27634069126. If not, you can send through a text message. We are live on TikTok. So at Channel Africa 1 is live on TikTok. I was like, wait a minute. Talk about a station evolutionizing, if you will, and sort of integrating themselves into technology. I'm also live on MS_NDIKUMANA. The guest we're about to introduce is not only renowned and noted for her specialization in urology, and as well as being a fellow of the College of Urologists of South Africa, but she's also a visionary leader in healthcare reform. Dr. Viola Morolo is known for her deep commitment to urological care, especially in the fields of cancer. And she's going to be joining us just to speak to us firstly about her passion, but also looking to pioneer a week that I think would be rather interesting. I know that she has shown part of her caliber of her work by participating in the Cure Day Hospital Midstream, where she helps to establish a center of excellence. But her impact does not stop there. As the founder of the African Synergy Health, a non-profit that tackles South Africa's surgical backlogs, she's spearheading this initiative that is noted as the Mandela Week Surgical Marathon, an ambitious, life-changing project aimed at wiping out elective urological surgical waiting lists in the public sector. And today she joins us on the line to tell us more about the movement, the medicine, and the meaning behind it all. Dr. Viola, good evening to you. Welcome to Heartlines.
Good evening, Shayla. Thank you, and to your listeners, thank you for inviting me into your show.
For the listeners who may not know, what exactly does a urologist do, and why is your specialty so crucial to everyday healthcare?
Okay, a urologist is basically a specialist who deals with the urinary system and the male reproductive system. So just to summarize, it's about the kidneys, which are the organs that clear off the toxins from the blood, and then they make urine, and then that urine is then transported to the bladder through the ureters. And then, of course, we all know the bladder, which stores the urine. And then, of course, you urinate through the urethra, which is the pipe that in females is very short, but in males, it's inside the penis. It passes through the penis. So the penis is also one of the organs that urologists work with. And then, of course, we've got the prostate, which is important in males, which is an organ that lies below the bladder, around that urethral pipe, the pipe that you urine through. And then, of course, there's also the testes. So most people think that urologists are actually male doctors, but you can imagine females also have a kidney and a ureter and a bladder and a urethra. So it's just that in addition, males have the prostate and the testes and, of course, the penis. So it's specialists who deals with those organs.
And you've worked...
And maybe just to finish it off, those organs, the spectrum of diseases is obviously cancers that affect those organs, urinary tract infections, incontinence, for example, kidney stones, children diseases, for example, hypospadias, where there's abnormalities in the urethra, infertility in males. Females, normally it's incontinence and pelvic organ prolapse, where there's parts of the bladder or the rectum that passes through the vagina. that protrudes through the vagina. So it's a full spectrum of a wide variety of conditions, both male and female, that we assist patients with.
And doctor, you have worked extensively both in the public and the private healthcare system, right? What are some of the differences that stand out? I know we all know that there are differences, but for you as a practitioner, somebody who's delved in both ends of the spectrum, what are some of the inconsistencies, some of the differences, and perhaps even highlighting some of government's wins would be a good one?
And possibly that's where I'll start, because I'm so I come from a government where we're all trained as specialists. We're trained in the government health sector, in the government, hospitals, the universities, which train us through the government hospitals. And a big bonus or a big plus in the government settings is the training, which includes the ward rounds, the educational training, the skills transfer, and also the research that happens in government hospitals. And that can never be underestimated, because the kind of knowledge transfer that happens from the professors in any department through to the registrars, in fact, to the consultants, to the registrars, to the medical students, is just amazing. The amount of collaboration, the amount of information sharing, discussions around patients. When you're a patient and you land up in a government hospital, the benefit is that you've got a team of doctors that are actually there putting their heads together to decide with yourself on what the best option for your condition is. And if you juxtapose that same patient who now presents in a private hospital is treated by one practitioner who then decides on their own what the best option, of course, they also shared decision making with the patient.
Yeah.
But in essence, there's one brain as opposed to multiple brains that are put together in the public sector. That for me is the big plus with the government setting because of that. Now, if you look at the negatives of the government and the positive of the private, is that in the private sector, the number of patients are by far less, and so the turnaround times in getting to your diagnosis and investigations and treatment is a lot less. Now, if you look at a patient, for example, who presents in the private sector, they get seen by the healthcare professional in a shorter period of time in terms of the booking to actually have your first consultation. Then when you do get your first consultation, the investigations thereof to reach a diagnosis is a lot shorter. And then, of course, when the diagnosis is reached, for you to actually get the ultimate treatment, whether it's surgery or medication or whatever intervention is to treat your condition, the turnaround time is a lot less because the demand is less. So the difference there in service delivery between government and private is that the demands and the supply is opposite. In the private sector, the supply far exceeds the demand, whereas in the public sector, the demand far exceeds the supply of healthcare professionals. The demand of patients far exceeds the supply of healthcare professionals, and it's the opposite in the public sector. And I believe the stats that was recently published was that it's an 80 to 20%. So in the public sector, there's a 20% of healthcare providers that are servicing an 80% of population, whereas in the private sector, there's an 80% of healthcare professionals that are servicing a 20% of patients. So, but having said that, still, the benefits of public in terms of the brains, the opportunities for extensive exploration of your conditions with a multiple of collaborations, both in terms of within a discipline and multidisciplinary, that can never be underestimated.
A comment coming in, and I think it speaks quite well to that staggering stat that you gave us with respect to demand and supply in the public sector, where we're seeing a demand at 80%, well, roughly or fairly at 80%, and the supply at 20% when it comes to public health practitioners. MJ Visache is saying, I hope we build better infrastructure for our doctors. They are our unsung heroes. And we're going to be delving into why you, Madam Madam Dr. Viola are an unsung hero of note. And I want us to get into that much later into the conversation. Let's come back and talk about this turnaround time, this demand and supply, if you will, issue that we are seeing. When did it become clear to you that surgical waiting lists had become a crisis, specifically in the public healthcare sector?
Well, I think my experience is experienced by if not all, registrars, because that's what you undergo. You're a registrar when you're undergoing your training to be a specialist. And I mean, what I experience is not unlike what everybody else experiences. So, when stats are communicated on the radios, like that, there's 3,500 patients on whatever waiting list. For myself and many other doctors, all other doctors, I should say, or registrars that are going through, training, it's not just the stat, it's actual patients. Now, I'll give you an example. When you're going through your registrarship, you see patients. I mean, your training is all about seeing patients and being trained by presenting those cases to your seniors, your mentors, and your consultants, and then through the presentations and working out what the diagnosis is, treating the patients, and of course operating on them. That's part of the training. That's actually on the job training, but also the theoretical part. But now, as you're seeing the patients and you're booking them, for example, let me just use an example for patients because my passion is uro-oncology. Patients that have got prostate cancer. So you have a patient coming in and you see them for the first time, and they're so hopeful that, finally they get to be seen by a specialist, because in that setting, you are a proxy of a specialist because you're in a tertiary hospital. And mind you, it takes a long time for a patient to actually get booked into a tertiary institution. So, the South African healthcare system is divided into primary, secondary, and tertiary. So when all specialists are trained in tertiary institutions, so by the time a patient is actually booked into a tertiary institution, they've come through multiple channels to reach you. So by the time they reach you, they're so hopeful that finally I've gotten to the right person who can help me. And you see them, and then of course they go through a whole lot of investigations, which in themselves also require multiple, other disciplines that they have to then visit and interface with, which also then has, the patient then has to wait additional time in those different departments. And finally, when they come back to you after having all those investigations and all the other departments, and sometimes it takes another 1 or 2 or 3 or 4 months for all that process to take place, then you reach a position where you advise the patient that these are the treating options that you have. And for example, if one of those options is a surgery, then you tell the patients, you discuss and you agree that the best option for this particular patient is, an operation. For example, patient with prostate cancer, we need to operate on you to remove the cancer so that you can be cured. And you give them a date, and sometimes the date is a month or even 2 or 3 months, after the time that you see them. And the patient waits for a long time for that time to come. And eventually when they come, the date arrives and they come and you are ready to operate on them. But for whatever reason, maybe there's no theater time, there's another patient that has been prioritized that is critical and has got in terms of triage, has got a, critical condition that if we don't manage it now, they may end up dying. So you've got another patient that, yes, is critical, but then they still got a, longer period before anything drastic happens. So then you're unable to help that patient because of that. There's other patients that have to be prioritized. Other times you're unable to help the patient because maybe there's no consumables, whatever, equipment or consumables that you need to operate on the patients at that time, they're not available. Or maybe the expertise to do the particular procedure is not there at the time. So time after time, you just, you encounter occasions where you, instead of bringing hope, which is what doctors are, we know that we bring hope to patients. Instead of bringing hope, we actually disappoint them because now they come hopeful that we're going to help them. And yet sometimes you're unable to help them because we have to postpone, sometimes even cancel. And worst case scenarios, sometimes when you are able to help a patient, their condition has progressed, and sometimes some of them have died. Unfortunately, there are instances that We phone a patient on the day that they're supposed to come, that they booked, and unfortunately the family tells you no, unfortunately the patient is no more. So all those experiences were just so disempowering as a healthcare professional when you interface with a patient and you are there throughout the journey when they first saw you being so hopeful, and then you journeyed with them to get the investigations, and then you journeyed with them to actually decide on what the best treatment option is. And at the time when you're supposed to provide that treatment, there are barriers again. And time and time when it happens, one felt like, how can I be part of the solution? It cannot be that it ends there where I just tell the patient, I can't help you for whatever good reason they may be. And that's how ASH was actually birthed. We had to come up with a way that we can augment the public healthcare system. I've already mentioned the benefits of the public healthcare system, but with the mismatch of supply and demand, there has to be some way to augment this excellent system, which just needs to be tweaked here and there. And so that's where African Synergy Health was birthed, to address the surgical waiting list, augment the current successes in the public healthcare system, and add value where the gaps are. If the gap is experts, we bring in the experts. If the gap is consumables, we've got some total of 37 sponsors that actually are part of our sponsors. Most of them are loyal sponsors that bring in the consumables that, for instance, sometimes are not available. Then if the gap is theatre time, we've got loyal hospitals that actually come to the party and say, you know what, we will be able to offer a certain number of beds, a certain number of theatre hours to help you with the surgical waiting list. So that's where African Synergy was birthed. We saw the problem and we saw a need for us to be part of the solution. And then we gathered a few urologists and surgeons, and we just committed to being part of the solution. And we have a big vision. So I suppose that's probably going to be one of your later questions. We have a big vision of having zero patients on elective surgical waiting list, meaning that as it is in private, when you get seen and you get investigated and a decision is taken that this is the best treatment option for you, which you accept, and that operation should happen within a reasonable period of time, unlike what is happening currently. And so that is our vision for us to have a zero patients on elective surgical waiting list. And it's a big vision, a compelling vision, but we truly believe that we can achieve it. With the few years that we've been in operation, we've been able to achieve so much with so little. And I believe if we have much more, we can achieve a whole lot more, and ultimately arrive at our vision of zero patients on elective surgical waiting lists.
The voice of Dr. Viola Morolo joining us this evening, specialist urologist and the founder of African Synergy Health, just detailing out the beautiful work that this nonprofit tackles, and this, of course, pertaining to South Africa's surgical backlogs. We're going to be getting into the Mandela Week surgical marathon, right? I do understand that yesterday marked the first day, the launch of the Mandela Week surgical marathon. How did it go? What was the process? Walk us through the day, in actual fact. Let's start there.
I just want to edit what you said now. So it was the first day of the ASH Mandela Week Surgical Marathon 2025. Our first marathon was in 2023. So this is our third essential marathon. And it was quite exciting because, in 2023, we had we were in one province. Last year, 2024, we were in two provinces. So we doubled. We were in Gauteng in 2023. Last year, 2024, we were in Gauteng and the Eastern Cape. And this year, we've doubled on 2024, and now we're in 4 provinces: Gauteng, Northwest, KZN, and Free State. And the launch was exciting because we chose Northwest because it's the first time that we're expanding into the Northwest. And it's a beautiful hospital called Job Shimankani Tabani Hospital, JST Hospital, which is in Rustenburg. And it's I came to realize that it's quite an underutilized hospital in Rustenburg, which has got a lot of, enough resources, but because of the gaps that are previously, highlighted, they are also not able to maximize their resources that they have. So it was a lovely launch. We had, the management of the hospital there, the CEO, and also the provincial representatives as well. So we were well received by the province. And it's exciting because in the actual hospital, we plan to do 18 patients from that hospital in a week, and in the 4 provinces that we're going to be working in, we plan in total 106 patients to be operated on. So we're quite excited because we've grown in such a short period of time, and we've got 4 provinces with so much, everybody's just so geared up from the patients, obviously, because they're excited wherever they are. We're excited to see them as they present themselves when their date arrives. But we know that the patients are so appreciative of the work that we do. Today, when I went to see the patients that we operated on yesterday, and I got feedback, the patient was just so excited to just communicate that, thank you so much for doing the operations that you did for me yesterday. So just to say that the launch went very, very well. It's a small part of what we're actually about. Yes, we have to acknowledge the formalities, but the big part of the marathon is actually the marathon, doing the operations, going into theater, operating on the patients, seeing the results. So that's the big part of what we're doing. But of course, the formalities also have to be done, and we appreciate the support. We appreciate the support that from our sponsors, especially because this could not have been done without the buy-in of the sponsor to our big vision. So it was a beautiful launch, very humble, in a very beautiful, humble hospital. But we look forward to, the result of this Ash Mandela Week Surgical Marathon 2025.
Dr. Viola, 106 patients. How many doctors, surgeons in particular, are required?
We haven't collated the actual numbers, but I'll just give you a reflection from last year. Last year, we did 168 patients. Incidentally, the number was much higher than we planned. So our target is always to do 67 procedures in all the provinces that we work in, aligned with the 67 minutes that we all encouraged to commit, to show that, as part of Mandela Day, that we are all, it's a global call to action for all of us to recognize the power that we have to make a difference and change the world around us by being of service to others. So we target that 67, instead of minutes, we now target 67 patients to be operated on, and per province. And last year we did 168, even though we worked in 2 provinces, and you can see that it's much more than the 67 times 2. So although this year we've planned to do 106, we're hoping that we'll do a lot more, because we're hoping to yet again reach our 67. But it's really not about the numbers. It's every patient counts, and so it's really not, it's using it as a motivation, but ultimately every single patient that we operate on is a patient that was on the waiting list that is now no longer needs to be on a waiting list, and they can actively then carry on with their lives and actually contribute towards their country, their community, and ultimately the world. Because ultimately, if you're not healthy, you're not economically active, and you can't actually contribute to your community and the world. And so all of us have an inherent right to at least be healthy so that we can contribute to the world.
Dr. Viola, I want to gauge the scope of your patients, and I suppose, of course, we can't get into critical information, but just to gauge the demographic, the age, the range. And I say this because there was a question that came about from Alunga, and he was asking, why do men need to see a urologist? We, of course, talked on the realities of cancer and incontinence. However, if you were to paint a picture, and I suppose we can use last year's reflections so as to be able to have a gauge on some of the people who would be part of this backlog on the list.
All right, so let me start with males because the question from Lunga was from a male. So the spectrum of conditions start from both the pediatric, meaning the children, right up to the adults and geriatrics, the adults and older population. So from the pediatrics, the typical patients that appear on the waiting list are, and I mentioned the condition earlier, hypospadia. It's a big word, but it simply means patients who've got a urethra that is underdeveloped, meaning that instead of the opening, the urethra, remember, is that pipe that I mentioned earlier that the urine comes out of through the penis. So hypospadia is a condition that affects males where the urethra is underdeveloped, meaning that instead of the urethral opening being at the tip of the penis, it's more towards the base of the penis, and it can be anywhere along that trajectory from the tip to the base of the penis. And so now, just to highlight the importance of the proper positioning of the urethral meatus, males are made to, the two important reasons why the urethra has to be at the tip is so that when they urinate, they can urinate standing up. And the second thing is that they can have an intravaginal ejaculation. This is urology, so I'm sorry if some of these things will offend your listeners, but the reality is that's the most important, the two most important jobs of the penis, to make sure that the penis and the urethra, to make sure that when you ejaculate, it's in the vagina, and the second thing is that you can urinate standing up. And so you can imagine that if the urethra opening is close to the base, you will not be able to urinate standing up because you will, urinate close to your clothes and you'll mess yourself. So you'll urinate like a female. But that's fine. But more importantly, you won't be able to ejaculate in a vagina so that you can actually reproduce. And so boys sometimes have those problems. And because it's not a medical emergency, those are the patients that are typically postponed. And so those are the patients that typically are on our waiting list. Today, we did some hypospadia repairs at the hospital in Northwest, the JST hospital, because those children, very young children, from the ages, normally we like operating as young as possible, hopefully before the age of 18 months. But as you can imagine, if you're on a waiting list, chances are that you're much older than that, 4, 5, 6 years old.
Yeah.
But ideally, you want to operate when you're 18 months. So we can do operations from the age of 18 months, but typically patients on the waiting list are not 18 months, they're much older. Those are children conditions. Other conditions for children is, for example, when they've got a testes that is undescended. Remember, the testes is supposed to be hanging in the scrotum, and when it doesn't descend, and you've got perhaps one testes or no testes in your scrotum, that is a danger, and it prevents it causes a threat to your fertility, because the sperm is not supposed to be in warm temperature. And when the testes is in the abdomen, it then assumes the temperature of the abdominal temperature, which is much higher than when it hangs outside. So those are the procedures that, bringing the testes down is one of the procedures that we also have to do. And as I mentioned, typically that is a procedure that it's not life-threatening. And as such, in a situation where you have to prioritize which procedures are of more higher priority, those would be the ones that are then overlooked, because there's patients who've got pressing, life-threatening diseases and conditions that need to be addressed. Now, if we look at the elderly, males, procedures that we typically do are, for example, when they've got a stricture, where the urethra is narrowed, and as a result, you're unable to urinate. And of course, the same tube is used to also ejaculate. So we then also have to do what we call a urethroplasty, where we have to block, operate so that we relieve the blockage that's there in the urethra. That can be for normally the middle-aged male adults. And then, of course, the elderly ones, it's patients who've got problems with their prostate, where their prostate is enlarged, and then as a result, they're unable to, urinate properly. I won't necessarily go too much into the cancers because cancers should not necessarily be overlooked. They should be prioritized. But unfortunately, even in our marathons, we have to do cancer procedures. Like today, we did 2 operations on patients with prostate cancer, and it's very exciting because we did a robotic procedure, meaning the surgeons that we operated on these patients, we use the technology of the robot. So we use the robot system and we operate on patients using the robot, and these particular patients had prostate cancer, the 2 of them that we operated on today. So that's the full spectrum, from the very young patients, the middle age, to the very elderly patients for the males. And then for the females, I mentioned that some patients have prolapse where the bladder or the rectum or it protrudes into the vagina. And so that's called a pelvic organ prolapse. And those patients need procedures to lift up the bladder, so the vagina, so that we actually lift up the vagina so that the bladder doesn't hang into the vagina. We essentially bring the support back. And so those patients, that's another typical patients where it affects their quality of life, but it's not necessarily life-threatening. You're not going to die from having pelvic organ prolapse. But for some patients, it actually affects their ability to urinate. But in the normal patients, it's just a quality of life issue. And those patients would also not be prioritized when it comes to, selecting patients in the government setting, where we have to prioritize which patients need to be put, on the theater table first. And so today we also did what we call a sacrocolpopexy, where we lift the vagina so that we can prevent that the bladder protruding into the vagina. So mostly, and that can also result in incontinence incidentally. So for the females, those are the typical procedures that are then overlooked: patients with pelvic organ prolapse. But in both males and females, one of the typical procedures that also is on a waiting list is patients with kidney stones. Not necessarily because it's not life-threatening, simply because the numbers are so high. There's a lot of patients with kidney stones. And unfortunately, patients with kidney stones, most of them need more than one procedure. So it's quite a taxing disease, because one patient may need 3 or even more procedures to actually clear them of the stones. So those patients typically are also on a waiting list, simply because it's a labor-intensive condition that requires multiple theater sittings before we completely clear the patient.
Doctor, a few questions coming in. I'll address the first being at any given point, was there a need for castration, especially with men?
That question is very broad. I think that perhaps the patient is the listener or the caller is talking about patients with prostate cancer, but I'll start from that perspective. So there are patients with prostate cancer that sometimes we need to castrate them, meaning we need to remove their testes. These particular patients normally are patients who have got cancer that has now spread, and so the aim is not to cure you from the cancer, but rather to prevent the ongoing spread of the disease. Now, the relevance for castration is that prostate cancer is fed by testosterone. So the testes produces testosterone. So one of the treatment options for patients with cancer, prostate cancer that has spread, is then to remove the production of testosterone by removing the testes. And as such, we then castrate you, because then you'll have a limited amount of production of testosterone. Testosterone is also produced in the adrenal gland, but then majority by far is produced in the testes. So that's the one aspect of castration. There's other reasons why one would have castration in the sense of medical castration, because remember, there's surgical where we remove the testes, but medical castration is where we give you medication to decrease your testosterone level. And sometimes it's one of the options for contraceptive. Is not a very common and first option, but it's another option as well. But by far the primary reason that we need to remove the testes or decrease your testosterone production is for patients with prostate cancer who have then got cancer that has metastasized or spread to other organs.
And doctor, what of your experiences with penile transplants can you share?
Oh, that is one of my favorite discussion points, especially in a social setting, because penile transplant is one of the least spoken about improvement in quality of life conditions and opportunities that is there, especially because so much is spoken about other forms of transplant, kidney transplant, liver transplant, corneal transplant, and yet little is spoken about penile transplant. Now, penile transplant was popularized by Prof. Van der Merwe, who performed the first penile transplant in South Africa in 2014. And Prof. Van der Merwe actually wrote his PhD on this, and primarily it was focused on patients who lost their penises because of traditional circumcisions, and as a result they got complications and they had a penile amputation, and as a result they needed a penile transplant. And we're talking about very young patients, young from the ages of 13. You can imagine the kind of patients that actually go for the traditional circumcision. And so the penile transplant is very non-spoken about, but very needed transplant for especially for young boys that could actually change their life. The one patient that I remember at one of the academic meetings that Prof presented his PhD was a young boy who actually had a penile transplant and subsequently then actually had a fertility, meaning the partner actually fell pregnant. And so you can see the result of a penile transplant that actually resulted in a fertility, where the man was actually able to have a child because he was now able to have an intravaginal ejaculation. So why I like this topic is because most men feel uncomfortable to donate their penises. Obviously, when you have a transplant, you have to have a donor organ, which means somebody has to donate their penises. And when we talk about this, people always are flabbergasted by the idea of donating your penis. But obviously, this doesn't mean that it's done while you're alive. It's done after you're dead. Unlike a kidney transplant where you can donate your kidney while you're alive because you can actually survive with one kidney, penile transplant, there is only one penis and everybody needs their one penis. So penile transplant, your penis can be donated once you've passed on. And so the message is when all of us, consider transplanting or donating our organs, don't forget the penis, because it's one of the organs that also can be transplanted and can change the life of many families, can improve the quality of life significantly.
Dr. Viola, listen, this is new to my ears and I'm sure to very many people. The realities of penile transplant. And I suppose it's also something taboo to our context, right? Because at what point do you have the discussion with yourself as a man? Perhaps you and your partner need to have this discussion as well. And so those are some of the things that I believe you will, of course, assist and spearhead in debunking so that this can be something that we commonly speak of and ensure that we are bettering the state of lives for those who are still alive and who do need a penile transplant. There is a question that came through here that was sort of asking about pelvic exams and andrology exams. Walk us through how often one needs to do these.
Okay, before I go into this question, I just want to close off the topic about penile transplant.
Yeah.
Just in terms of the feedback. One of the things that Prof. Van der Merwe also communicated was that part of the reasons why there's a shortages of penises to be transplanted is because on the male side in the African, meaning the black males, they are uncomfortable with donating their penises because the males seem to be concerned about what then in the afterlife if you need your penises. So there's a belief that what if you need your penises in the afterlife and you've already donated it?
Oh, no.
So it's quite fascinating because one would think it's a strange answer, but
Yeah.
it's crazy how common that response is to males. So I would encourage you and your listeners to perhaps ask your partners or family if they would consider donating a penis. You spoke about the discussion when that discussion happens. So it's often a discussion that can happen in a party or any social gathering, just to inquire, would you donate your penis if you passed on? And you'd be amazed how many men would actually think it through and consider, what if I donated my penis and in the afterlife I now need it? What am I going to do? Yeah. So and on the opposite end, the feedback was that there are some females that feel like once their male's penis is donated, they almost feel like once their partner's passed on, they feel like they don't want to hand over the penis to another female because it feels like their partner is living on in their absence. So it's quite fascinating, the discussions that happen around penile transplant and the donor and the recipient and. Now, the question that you asked was around pelvic exam and andrology. So, andrology is quite a big topic. It's actually a subdiscipline in urology, which speaks mainly about fertility and mostly about erectile and also about erectile dysfunction. In terms of the spectrum of, when one should have an andrology examination specifically, most of the time patients present when they've got symptoms. For example, patients have got sexual dysfunction, and sexual dysfunction can be something like a poor libido, erectile dysfunction, ejaculatory, conditions where the ejaculation is either early, late, painful, or else they've got, they're dissatisfied with their sexual function. So those are the 4 common core, reasons for patients to consult. It's uncommon for a patient to present for an andrology examination without any symptoms. As you can imagine, and unfortunately, males do not necessarily have very high health-seeking behavior, so they normally present when there's a problem, when there's symptoms. And the other component of andrology is fertility, meaning males who then are unable to, make a woman pregnant after trying for a year and having, engaged at least 3 times a week. That's actually the definition. So you need to engage with your partner 3 times a week at minimum for a year, and not for, your partner not fall pregnant before you actually, regarded as being infertile. So, and then of course, those are typically the patients that then present, and then we investigate what could be the reason. But obviously, in terms of, fertility, it could be the male counterpart or the female counterpart. But from a urological perspective, we then investigate the males. In terms of pelvic examination on the female side, we spoke about incontinence and pelvic organ prolapse. Again, there's no routine examination for pelvic examination in the context of andrology and females. If you have symptoms, then of course you need to consult your urologist, especially because urologists are best placed to deal with bladder problems and as I mentioned, erectile dysfunction and fertility for the males. But the routine pelvic examination that the listener or the caller may be inquiring about is for prostate cancer. So all males over the age of 40 if you've got risk factors, and 45 if you don't have risk factors, are encouraged to have a regular examination by the urologist to screen for prostate cancer. This is very important because prostate cancer is very common among the African population. Now I'm speaking specifically the Black African population. So it's important for you to screen for prostate cancer because being African means that you're at high risk. So already you should be screening from the age of 40. The other risk factors are family history of prostate cancer, and then of course age. The older you are, as you 50 and above is already starting to have a risk for prostate cancer. But by the age of 70, the risk factor for prostate cancer increases significantly. So age, family history, and African descent are the three main risk factors for prostate cancer. And those are typically the patients, the population of people that should be coming for the regular examination to screen for prostate cancer. And that examination will include a rectal examination, which would then be regarded as a pelvic examination, perhaps in the context of the caller or the listener.
The voice of Dr. Viola Morolo joining us this evening. And we're looking at quite a few topics, of course, encircling what's happening this week or throughout this week, which is the Mandela Week Surgical Marathon 2025, highlighting some of the reasons which one would pursue her specialties, that is the specialty around urology as a whole, as a collective. And so I wanted to take a quick breather. When we get back, we continue these conversations. Send through your questions. Finding us on WhatsApp +27 6340 69126.
Heartlines, 10 p.m. to midnight Central African Time with Shayla Dukumana. Ahoy, matey!
Captain here to help, right, boys?
Set sail with us on a digital voyage like no other. Channel Africa has a treasure trove of awesomeness. That is our website and social media pages.
Tell me, why are you here?
We want you to be part of our adventure.
The winds are changing, Captain. And this time...
Imagine a world where curiosity knows no bounds, where entertainment meets enlightenment, and where every click leads to the African perspective. Visit us on our website, www.channelafrica.co.za, or follow us on Instagram or on X at Channel Africa One. Go on, like us on Facebook at Channel Africa One. So, spread the word. Tell a friend that Channel Africa's online variety is what they need on the web. Channel Africa, the African perspective.
SABC Sport brings you Chasing the Sun, a powerful 5-part documentary series about the Springboks, telling the rousing tale of their path to redemption and ultimate World Cup glory in 2019. Tune in every Sunday for the highs, the heartache, and the heroics that made rugby history. Stream each chapter on SABC Plus anytime, anywhere. No subscription needed. Don't miss Chasing the Sun this Sunday at 7:30 p.m. on SABC 2. Be there when history shines.
Heartlines, 10 p.m. to midnight Central African Time with Shayla Dukumana.
We are still in conversation with the founder of African Synergy Health, also a specialist urologist joining us this evening, Dr. Viola Morolo. And quite a few to unpack are the subject matters. However, the central focal point being Mandela Week Surgical Marathon 2025, an ambitious, life-changing project aimed at wiping out elective urological surgical waiting lists in the public sector. Dr. Viola, we sort of strayed on a tangent, but one so significant that I feel we need to have you back to just unpack the spectrum of I suppose, reasons one would want to see a urologist, specifically looking at some of the myths that one ought to debunk concerning things like penile transplants and the like. Let's move into the surgical, I suppose, the marathon and the bigger picture around the marathon. I know that you partnered with organizations like Wise Med. How important is it for you to find these collaborations, of course, as ASH, and ensure that people are in partnership with you in order to carry out the week?
Okay, it's crucial. ASH heavily depends on our sponsors. We've got a very functional and successful sponsoring model where our sponsors come on board, and I mentioned that the function of ASH, the role of ASH is to bridge the gaps in government. So then our sponsors, actually our sponsoring model is such that we communicate where the gaps are, and then our sponsors then come in and say, you know what, you mentioned that there's a gap of consumables. We provide these consumables. We're more than happy to donate these consumables as part of our ASH Mandela Week. So, as part of our Mandela Day initiative. And that is the reason why we actually linked it up with Mandela Day. Because we want to, there's a lot of companies that are out there that are so willing to be part of the solutions in the South African spectrum of problems, but they don't actually know how they can contribute to the betterment of our country. And so we then provide that opportunity for companies to then join us in our vision of having zero patients. I like the way you say wipe out the waiting list, which is exactly what we are on a journey to achieving, to wiping out those waiting lists. And we really thank our sponsors for buying into our vision. And so we essentially, in the beginning, it was just a vision. And then I remember I mentioned in the beginning that this came up as an experience while I was a registrar. And through communications with the representative of all these companies, you then communicate that, this is what, everybody's aware of the problems in government, including the reps of the sponsors. And so as human beings, everybody wants to be part of the solutions as well. And so it was very easy, to communicate our vision, to get the buy-in of the sponsors, because it's something that they were also aware of, and it's something that they can they can contribute very easily with, because they know what the problems are and their solutions are they're actually able to be part of the solution, having being the suppliers of some of these consumables, for example, that are required. So our role is essentially to try and bring in as many sponsors as possible, so that we can do a lot more. One of the challenges that we're having is that because our funding model, sponsorship model, is very focused on consumables, human resource, hospital beds, and yet less on financial sponsorship. There's a gap sometimes there where we also need financial sponsorship, because some of the patients, and I'll give you actual examples. There's a patient today where we operated in theatre, and because when a patient goes into theatre, we may not know the full spectrum of what the patient may need intra-op. For example, if a patient is coming for a radical prostatectomy to remove their prostate in theatre, we know that the consumables required is, we've got a list of consumables that are required for the procedure. We know that we need a theatre bed, which the hospital provides. We know that we need a bed in the hospital after the patient is operated on. So there's things that we are under our control, but things that are not in our control. For example, a patient's blood pressure may go down, and they may need medication to actually lift their blood pressure, which is something that we may not have anticipated, because every patient is different. And so we don't necessarily have sponsors for that particular medication that is required at the time. And so we have to tap into some of our educational grant, where we then have to fund the additional costs for the procedure, which were not anticipated. So at the moment, ASH is in need of expanding our sponsorship model to have more of a grant or financial sponsorship that can bridge the gaps of other areas that we hadn't anticipated, or we cannot actually prepare for, because every patient is different. And so we appreciate some of our sponsors who, in addition to providing consumables, also then provide us with an educational grant that can then bridge those gaps for financial, needs that the organization has.
And Dr. Viola, do you see or foresee Mandela Day, I suppose Mandela Week in actual fact, surgical marathon, sort of expanding its model to accommodate other medical fields in order firstly to garner sponsorship, but also to bring about a well-rounded offering for, of course, the patients on the lists?
Absolutely. Our vision is to have 0 patients on elective surgical waiting lists in the public hospitals, starting with urology and general surgery in South Africa. But the intention is to expand to other surgical disciplines. Waiting lists are not only a problem in urology and general surgery, other surgical disciplines, orthopedics, ophthalmology, ENT, all of those other surgical disciplines have also got waiting lists. So we intend to expand to other surgical disciplines, but also to other African countries. And that's why our name is African Synergy Health. We chose our name quite intently. We are targeting the African continent because charity begins at home. In Africa, we're starting with South Africa, but of course, we're targeting the African continent. And the word synergy means our contribution together is greater than the sum of our individual contribution. And that's central to our operations and even our funding model and actually our mission, because we synergize both the public and the private resources. At the beginning of our interview, we spoke about the benefits of the public sector. And so we synergize both the public and the private resources because both of them have got their strengths and have both got resources that ASH can definitely maximize. So that's our funding model, and that's how our operations, because we believe that we can actually do more together than just working individually as silos of public and private.
Dr. Viola, we are simmering down to the end of the conversation, but I've got 2 questions for you, right? The very first being, of course, it is evident that you are passionate about restoring dignity through healthcare. What drives you on the daily, and what keeps you steady pacing when the challenges are getting tough and you begin to feel overwhelmed with the level of responsibility you carry?
Wow, you're asking a question where it's very pertinent, especially in this time, because you plan so much for the marathon, but on a daily basis, it feels like you're carrying a weight that you didn't anticipate, and you sometimes question, really, is this, how is this going to happen today on a daily basis? Because you can imagine the daily challenges that we come through this. You should see our project plan. It's like different provinces, multiple hospitals, multiple patients with their surgeons and their times and their anesthetists and the companies that are sponsoring each patient. But what motivates me is the fact that there are patients behind everything that we do, and there's nothing more rewarding than when you have a patient look in your eyes and saying thank you, as opposed to saying, being disappointed, because that's the opposite. What was the case, which is the solution that we're kind of trying to come with, was patients would be so disappointed when they came after waiting so long and being so hopeful, and now they're disappointed. And now what we're offering now is a thank you, a gratitude. And so what motivates me in everything that we do, especially with regards to ASH, is the fact that I know that if we achieve, even if it's not 100% of what we aim to achieve, because the vision is going to take a while to achieve, but we will achieve it. I'm confident of that. While we have these bite-sized successes, that motivates me. I'm excited about the smiles that I see on my patients. I'm excited about the fact that they can actually get on with their lives and contribute like I'm contributing to my community, because I'm a healthcare professional, but the patients have got their own skill and their own talent that when they're sick, they're not able to actually maximize on those skills and those talents. And so I'm excited about patients having quality of life, contributing towards this beautiful world, and then being part of the solution in other areas, while I deal with the the small area in my healthcare professional, little corner. So that excites me, the fact that we can make a change in patients' lives, and that will ultimately make a change in their small community, in their family and their community, and ultimately in the world. I'm stimulated by the Mandela and what he did. That cannot go without being said. And specifically on our letterhead, there's a quote from Mandela that inspires me every day, which says that it always seems impossible until it is done. And our vision seems impossible, but it will be done. And that's what stimulates me, doing something that seems impossible, but actually making it possible. When we first spoke about our vision, it seemed like an impossible, in fact, sometimes even laughable vision. But now when we say it so confidently, because people are beginning to see that, you know what, we are working towards it. It's still a very, ambitious vision, but it is possible. Suddenly it is possible. We've gotten so far. We've done 230 procedures in 2 years. What can we do with a little more resources and a little more time? So I'm inspired by what we've done. I'm inspired by the outcomes of what we've done, which is the outcomes on the patients. And I'm inspired by the generosity of the sponsors and people out there. I'm inspired by how people are just willing to help and also be a part of this movement.
Dr. Viola, I'm inspired by your African print scrubs. Am I misled there? Am I misled?
No, these are S scrubs. This is our logo. So,
Okay.
So this is another sponsor. Like I said, the sponsors are aligned to their service. So Professional Linen is actually one of the companies that makes scrubs. And they came on board and said, you know what, we'll provide scrubs for your nurses, the doctors, and, all the role players. Our sponsors we've also given them scrubs. So Professional Linen provided us with 200 scrubs for all the role players in this. So
Wow.
this is one of the scrubs that I'm wearing today. And we'll be on my Instagram page. I've posted all the hospitals that are wearing their scrubs, taking pictures, and it's just beautiful. And so this is possibly a moment for me to also just thank Professional Linen for being so generous and providing us with these 200 scrubs. They are so beautiful. And this also just communicates our commitment. And I mentioned about robotic surgery. We've got sponsors that are so generous that they provide the best service, the best quality, even when it's donated items. I mentioned that we are doing robotic surgery. I mean, robotic surgery is world-class, the most advanced technology. And we are doing this for patients who are on waiting lists, and yet they still get the global gold standard treatment. And similarly with these scrubs, they are so beautiful. I mean, I wish I could actually show you the full, suit, but so and this just demonstrates the quality of service that we're providing, even if it's to patients who are on waiting list. We still care about them. We're still giving them the best quality of service. And
Dr. Viola, do not despair. You said your social media platform, so share that with us so we can head over to those platforms and see those lovely scrubs.
My Instagram handle is Dr. V, the female urologist. But I'd also like to share our African Synergy Health's website, which is www.africansynergyhealth, which is AFRICAN, Synergy, SYNERGY, Health, HEALTH.com. So Dr. V, the female urologist, as my Instagram page, and then www.africansynergyhealth for more information about African Synergy Health. And that's where you can see what we're up to. You can reflect on where we started, what we've achieved so far. If you buy into our vision and our movement, how you can become a donor. And and this goes beyond just financial donation. All forms of donations are appreciated. All forms. I won't go into any detail, but whichever way that you seem fit, that you would like to donate your time, your all things that are going to grow our movement, we will appreciate that.
The voice of the ever so stylish leading, and I say ever so stylish because I keep on staring at your scrub. So I've got access to the image, and I just keep on looking at that pattern, and I think to myself, that is not just a symbolic of the African continent, but it's also an appreciation for who we are, what we appreciate, the color, the nuances. And I just want to thank you so much for going ahead with that kind of logo, that kind of print, and those kind of colors. A leading urologist and founder of African Synergy Health. And here, of course, to unpack Mandela Week Surgical Marathon 2025, her fight alongside some 200 urologists and healthcare practitioners, of course, them trying to eliminate the backlogs in public hospitals and, of course, save many lives and make the lives of very many a beautiful one to experience. Doctor, thank you so much for joining us this evening. We appreciate your presence. Thank you for the work that you're doing. We can only hope that you grow bigger and better. And I do pray that this conversation pours an ounce and sort of tilts and sways the ears of those who can invest into your direction.
Thank you so much. Thank you for inviting me, and thank you to your listeners and your viewers. I welcome the invitation that you suggested that we can have more discussions in the future. So thank you very much, and I look forward to more discussions.
Again, the voice of Dr. Viola Morolo joining us this evening, 25 minutes before midnight. Let's get some music.
Heartlines, connecting you with Africa's love culture into the night on Channel Africa. The African perspective.
I can't deny it, it's written all over you. That you've taken all over me. You've taken all over me. All over me. If there isn't with your church mind, you gonna say you wanna be mine. Cause you've taken all over me. No need for story, you know be my charge. You make my temperature rising. Anybody mess with you, I will not take it till I leave. Oh, no, begging you, me, what me. Girl, I love you, show the people think I'm mental. I go carry you, go Cali, Sacramento. Love you, him, I be my Marutoleto. Love you, show the baby, you know, go feel, let's go. Look for my mind, I might only leave it rent free. For your matter, baby girl, I go comment. I'm gonna check away, though, tell me no bed, though. I can't deny it, it's written all over you. That you've taken all over me. You've taken all over me.
Channel Africa. More than just a broadcaster, Channel Africa is the pulse of the continent, African-led, African-run, and deeply rooted in its heritage. It's the only international station that speaks to Africa in its own voices: English, Kiswahili, Chinyanja, French, and Portuguese. The languages that unite 1 billion people. We have been there through every shift, every milestone, and every triumph. Not just reporting history, but shaping the conversations that define Africa's future. For brands, media planning, and advertisers, Channel Africa is more than just a platform. It's an opportunity. With 25 compelling shows covering current affairs, sports, business, music, and lifestyle, we deliver an engaging Pan-African audience ready to connect, invest, and act. Multi-award winning, internationally recognized, digitally accessible across the globe. When Africa speaks, the world listens, and Channel Africa makes sure of it. For business, for culture, for Africa, partner with Channel Africa, because Africa's voice is the future. Africa is a story, a living, breathing, ever-evolving masterpiece. And for over 5 decades now, One voice has told it like no other. Channel Africa. More than just a broadcaster, Channel Africa is the pulse of the continent. African-led, African-run, and deeply rooted in its heritage. It's the only international station that speaks to Africa in its own voices. English, Kiswahili, Chinyanja, French, and Portuguese. The languages that unite 1 billion people. We have been there through every shift, every milestone, and every triumph. Not just reporting history, but shaping the conversations that define Africa's future. For brands, media planning, and advertisers, Channel Africa is more than just a platform. It's an opportunity. With 25 compelling shows covering current affairs, sports, business, music, and lifestyle, we deliver an engaging Pan-African audience ready to connect, invest, and act. Multi-award winning, internationally recognized, digitally accessible across the globe. When Africa speaks, the world listens, and Channel Africa makes sure of it. For business, for culture, for Africa, partner with Channel Africa because Africa's voice is the future. Africa is a story, a living, breathing, ever-evolving masterpiece. And for over 5 decades now, one voice has told it like no other. Channel Africa. More than just a broadcaster, Channel Africa is the pulse of the continent. African-led, African-run, and deeply rooted in its heritage. It's the only international station that speaks to Africa in its own voices. English, Kiswahili, Chinyanja, French, and Portuguese. The languages that unite 1 billion people. We have been there through every shift, every milestone, and every triumph. Not just reporting history, but shaping the conversations that define Africa's future. For brands, media planning, and advertisers, Channel Africa is more than just a platform. It's an opportunity. With 25 compelling shows covering current affairs, sports, business, music, and lifestyle, we deliver an engaging Pan-African audience ready to connect, invest, and act. Multi-award winning, internationally recognized, digitally accessible across the globe. When Africa speaks, the world listens, and Channel Africa makes sure of it. For business, for culture, for Africa, partner with Channel Africa because Africa's voice is the future. Africa is a story, a living, breathing, ever-evolving masterpiece. And for over 5 decades now, one voice has told it like no other. Channel Africa. More than just a broadcaster, Channel Africa is the pulse of the continent. African-led, African-run, and deeply rooted in its heritage. It's the only international station that speaks to Africa in its own voices. English, Kiswahili, Chinyanja, French, and Portuguese. The languages that unite 1 billion people. We have been there through every shift, every milestone, and
42 minutes after 11 p.m. Central African Time. Crayon alongside Kamido, Costa Titch and Focalistic on Ijo Laba Laba, the remix. If you've just joined us, welcome to it. This is Heartlines, fairly 18 minutes before the show comes to an end. What an intriguing conversation we had with our leading urologist and founder of African Synergy Health. And she was, of course, here to unpack the Mandela Week Surgical Marathon 2025. The voice and, of course, presence of Dr. Viola Morolo joining us. Very, very pertinent questions coming out about organ transplants, ones that not too many people are aware of it, or if you are aware, you somewhat to an extent, you have a view on it that perhaps pertains to culture, tradition, and your experiences and your perceived view of the afterlife. And so she made the statement that penile transplants are one of her favorite conversations because she looks to debunk the realities and also spread the positivity about how you can save the next life. And from that conversation, of course, tracking back to what will happen throughout this week. The marathon is set for this week, and they launched it yesterday, of course, kick-starting off the week that lies ahead. I think what I really appreciated about the conversation is her honesty to say that there's quite a bit of responsibility that lies on her shoulders, but of course her and some 200 healthcare professionals are coming together in 4 provinces in South Africa to try and eradicate that list that sort of encompasses what we dread and obviously want to see disappear, the backlogs when it comes to the public healthcare facilities and hospitals. And so this evening, I'd love to find out from you with respect to your pursuit. We spoke about urology. However, maybe that's not your field. That's not your focal point. I'm going to read you a statement and then I'll follow this up with a question. And I'd love to hear from you this evening. Send through a voice note. I'm going to go against texting for this evening because I'd love to hear your voice. +27 6340 69126. The statement is, when your craft becomes a conduit for impact, it stops being just work and becomes purpose. Have you found your purpose, is the question. I'll read that statement again. When your craft becomes a conduit for impact, it stops being just work. It becomes purpose. Have you found your purpose?
Heartlines. Your late night window into Africa's deep conversations.
Yeah. Alright, into me, na. Yeah. Alright, into me, Black jersey on the beat. Baby, me tired.
Africa is a story. A living, breathing, ever-evolving masterpiece. And for over 5 decades now, one voice has told it like no other. Channel Africa. More than just a broadcaster, Channel Africa is the pulse of the continent. African-led, African-run, and deeply rooted in its heritage. It's the only international station that speaks to Africa in its own voices. English, Kiswahili, Chinyanja, French, and Portuguese. The languages that unite 1 billion people. We have been there through every shift, every milestone, and every triumph. Not just reporting history, but shaping the conversations that define Africa's future. For brands, media planning, and advertisers, Channel Africa is more than just a platform. It's an opportunity. With 25 compelling shows covering current affairs, sports, business, music, and lifestyle, we deliver an engaging Pan-African audience ready to connect, invest, and act. Multi-award winning, internationally recognized, digitally accessible across the globe. When Africa speaks, the world listens, and Channel Africa makes sure of it. For business, for culture, for Africa, partner with Channel Africa, because Africa's voice is the future. Africa is a story, a living, breathing, ever-evolving masterpiece. And for over 5 decades now, one voice has told it like no other. Channel Africa. More than just a broadcaster, Channel Africa is the pulse of the continent. African-led, African-run, and deeply rooted in its heritage. It's the only international station that speaks to Africa in its own voices. English, Kiswahili, Chinyanja, French, and Portuguese. The languages that unite 1 billion people. We have been there through every shift, every milestone, and every triumph. Not just reporting history, but shaping the conversations that define Africa's future. For brands, media planning, and advertisers, Channel Africa is more than just a platform, it's an opportunity. With 25 compelling shows covering current affairs, sports, business, music, and lifestyle, we deliver an engaging Pan-African audience ready to connect, invest, and act. Multi-award winning, internationally recognized, digitally accessible across the globe. When Africa speaks, the world listens, and Channel Africa makes
Heartlines, 10 p.m. to midnight Central African Time with Sheila Ndikumana.
Les gens me disent, les gens me oisent, et c'est ma bitch, et je suis son gars. On est dans le NAG, la capitale. Oh ma panne, oh ma panne. On est dans
Africa is a story, a living, breathing, ever-evolving masterpiece. And for over 5 decades now, one voice has told it like no other. Channel Africa. More than just a broadcaster, Channel Africa is the pulse of the continent, African-led, African-run, and deeply rooted in its heritage. It's the only international station that speaks to Africa in its own voices: English, Kiswahili, Chinyanja, French, and Portuguese. The languages that unite 1 billion people. We have been there through every shift, every milestone, and every triumph. Not just reporting history, but shaping the conversations that define Africa's future. For brands, media planning, and advertisers, Channel Africa is more than just a platform, it's an opportunity. With 25 compelling shows covering current affairs, sports, business, music, and lifestyle, we deliver an engaging Pan-African audience ready to connect, invest, and act. Multi-award winning, internationally recognized, digitally accessible across the globe. When Africa speaks, the world listens, and Channel Africa makes sure of it. For business, for culture, for Africa, partner with Channel Africa, because Africa's voice is the future. Africa is a story, a living, breathing, ever-evolving masterpiece. And for over 5 decades now, one voice has told it like no other. Channel Africa. More than just a broadcaster, Channel Africa is the pulse of the continent, African-led, African-run, and deeply rooted in its heritage. It's the only international station that speaks to Africa in its own voices: English, Kiswahili, Chinyanja, French, and Portuguese. The languages that unite 1 billion people.
51 minutes after 11 p.m. Central African Time. Eboko Loko taking us to the beautiful landscape of Gabon with this one titled Satanana alongside Dre A. Before that, Tiwa Savage with Attention taking us to Nigeria. Time for us to wrap up the show that was. If you have just joined us, Heartlines with Sheila Ndikumana. We do this every Monday to Friday between 12 or rather 10 and 12. Look at me trying to take a hold of Morris Touch's slot, who joins us on the line this evening, broadcasting live from Bulawayo in Zimbabwe. Morris, good evening to you.
Good evening, Shayla. How are you doing?
Fantastic. Morris, I hear that we need to introduce you to the YouTube channel Starter Pack.
Please do. Please do. Take me on that fantastic technological ride. I would love that.
So, number one, we need a tripod. Okay. Number two, we need a ring light. Okay. Number three, we need a big smile. And number four, you need to confidently say, Morris, confidently, welcome to my YouTube channel.
Welcome to my YouTube channel, courtesy of the one and only Sheila Ndikumana.
Absolutely, Morris. What can we expect on the Afro Republic this morning?
Right. Are we documenting enough stuff when it comes to African music? Is the African music space writing its own stories? Why do I say this? I have a book that looks at world music. and you will find that the stories within the African music space are actually written by people that are not from Africa. And that information, sometimes when you read the book, you find that it's not exactly what it is. What they are referring to is maybe the best African artist. It does not come out as the best African artist. People that write these books from either Europe or the Americas have their own understanding of our music, and they'll tell you that this one is number one. But what do we say as Africans? Why aren't we documenting our own stuff? Why aren't we sitting down and having an African going around the continent and putting up stories or writing stories that have so much to do with our music from an African perspective, like we do as a broadcaster? So that's what I want to look at today and see if ever we have enough literature about our own stories when it comes to music.
Morris, that proves to be a very pertinent question, especially because we have the efficiencies of AI to assist us.
Yeah. One thing that I realized, Sheila, we interview a lot of artists. They are fantastic stories that I have had to engage with with so many artists. But no one is writing about them. But when anything negative or anything goes south towards that artist, you will hear everything about it. But we don't get a positive spotlight on our African artists. So we need to write our own stories. Basically, we need to tell our own history, write our own history.
Yes, I agree with you, Morris, and we cannot wait to hear you delve into that subject matter. From the team and I, it's been a pleasure. The voice of Morris Touch of the Afro Republic up next between midnight and 3 a.m. in Central African time. Please do take care of yourselves, and we'll catch up again tomorrow between 10 and midnight. Cheers.
Heartlines, 10 p.m. to midnight Central African Time with Sheila Dukumana.